cutting the ball and throwing it away, but as the patient uses the hip, more and more bone gets dissolved, or what we call as osteolysis. So these are the problems with conventional hip replacement. Now when it comes to hip resurfacing, in theory it solves all these problems. We don't cut and throw bone away, we retain all the bone, there's no risk of dislocation. The risk of dislocation is same as a normal hip. There's no restriction of activity as well. Patient can do whatever they want. So it's really the difference between night and day if you want to compare for a young active patient, resurfacing on one side and conventional hip replacement on the other side.
Please tell us a little bit about your experience, your training, and how you got started specifically with hip resurfacing, your specialty.
Well, I did most of my orthopedic training in the UK. I was training with Birmingham when I worked with Mr. Tracy and Mr. Meckman, who were actually the ones who developed the hip resurfacing way back in the early 90s. So I was working with them. Then I continued to train with them for further about 3 years. And then I came back to India in 2000, and then I was the first one to start doing hip resurfacing in a big way in India. And then we have been